Hello there! Today we're going on an adventure inside our own bodies to discover something truly amazing: bone marrow. Imagine your bones are not just solid sticks, but clever hollow tubes. Inside these tubes there is a special spongy tissue called bone marrow. It is a bit like the soft center of a jam-filled biscuit. This incredible substance is found in the middle of your bigger bones, such as your hip bones, your thigh bones, and even the bones in your spine. It might be hidden away, but it has one of the most important jobs in your entire body, working tirelessly every single second of every day, without you even noticing. So, what exactly does this spongy stuff do? Well, you can think of your bone marrow as a bustling factory that never closes. Its main job is to make all the different types of blood cells your body needs to stay healthy and strong. Every day, this factory produces billions of brand new cells. These cells are essential for everything from carrying oxygen to fighting off germs. Without this constant production line, our bodies would quickly run into trouble. It's a non-stop process that ensures we always have a fresh supply of blood cells to keep us going, repairing our bodies and protecting us from illness. Let's meet the workers from this factory. The blood cells. First, we have the red blood cells. These are like tiny delivery drivers that carry oxygen from your lungs to every single part of your body, giving you energy. Then there are the white blood cells, which are your body's personal army. They seek out and destroy nasty germs and viruses that could make you ill. Finally, we have platelets. These are like little paramedics. When you get a cut, they rush to the scene and clump together to form a clot, which stops the bleeding. All three are vital for keeping you in tip-top shape. The bone marrow is a perfect example of how brilliantly our bodies are designed. It is tucked away safely inside our strong bones, protected from harm while it carries out its crucial manufacturing role. This factory is not just making one product, it is creating a complex team of cells, each with a specialized function, all working together in harmony. From the moment we are born, our bone marrow is on duty, ensuring our blood is always ready to do its job. It's a remarkable system that shows just how clever our bodies are at looking after themselves from the inside out. Now, not all bone marrow is the same. There are actually two main types, and they are named after their colors: red marrow and yellow marrow. Red marrow is the part we have been talking about, the super busy blood cell factory. When we are babies and young children, nearly all of our bone marrow is red. This is because our bodies are growing very quickly and need a huge supply of new blood cells to support that growth. As we get older, the amount of red marrow changes, but it remains incredibly important throughout our lives for producing those essential blood cells. So, what about yellow marrow? As we grow into adults, some of our red marrow gets replaced by yellow marrow. This type of marrow has a much higher amount of fat, which is what gives it its yellowish color. Its main job is not to produce blood cells, but to act as a storage space for fats. You can think of it as a pantry inside your bones, storing up energy that your body can use if it ever needs it. While it doesn't usually make blood cells, it holds a clever secret. In an emergency, like if you lose a lot of blood, yellow marrow can change back into red marrow to help produce more blood cells quickly. The balance between red and yellow marrow is a clever part of our body's design. In adults, red marrow is mostly found in the flat bones, like your hip bones, ribs, and skull, and at the ends of long bones, like your thigh bone. These are the key sites for blood cell production in adulthood. Yellow marrow fills up the central part of these long bones. This arrangement ensures that the most active factories are located in protected areas, while the rest of the space is used for energy storage, which is also very useful for keeping our bodies running smoothly. This dynamic duo works together to support your body's needs. The red marrow handles the day-to-day manufacturing of your blood's cellular team, keeping your defenses strong and your body oxygenated. Meanwhile, the yellow marrow acts as a quiet but ready reserve, storing energy and standing by to jump into action if the body sends out an emergency signal for more blood cell production. It is a fantastic example of how our bodies adapt as we age, ensuring we have exactly what we need when we need it to stay healthy and active. Sometimes the bone marrow factory can stop working properly. This can happen for several reasons. Certain illnesses, like leukemia, which is a type of blood cancer, can cause the marrow to produce faulty, cancerous cells instead of healthy ones. Other conditions, such as aplastic anemia or some immune system diseases, can damage the marrow so much that it stops making enough blood cells altogether. When this happens, a person can become very unwell, as their body no longer has the red cells, white cells, and platelets it needs to function. In these situations, doctors might suggest a bone marrow transplant. A bone marrow transplant is a special medical procedure to replace damaged or diseased bone marrow with healthy new marrow. The goal is to give the person a brand new, functioning blood cell factory that can start producing the healthy cells their body needs. Before the transplant, the patient often receives high doses of chemotherapy or radiation. This is done to clear out the old, faulty marrow and make space for the new, healthy cells to grow. It is a bit like preparing the ground before planting new seeds in a garden. You need to remove the weeds first. There are two main types of transplants. The first is called an autologous transplant. This is when doctors collect and use the patient's own healthy stem cells. These cells are taken from the patient's blood or marrow before the high-dose treatment begins, stored safely, and then given back to the patient afterwards. This type of transplant is often used for certain cancers, like lymphoma or myeloma. It helps the body recover its ability to make blood cells after the intensive treatment has finished, using its very own cells to rebuild the factory. The second type is an allogeneic transplant. This is when the new, healthy bone marrow cells come from another person, called a donor. The donor needs to be a very close match to the patient, which means their body tissues are genetically similar. Often, a brother or sister is the best match, but sometimes a volunteer donor from a registry is needed. This type of transplant is used for diseases like leukemia, where the patient's own marrow is the source of the problem and needs to be completely replaced. The new donor cells build a whole new immune system for the patient. After a bone marrow transplant, looking after yourself is incredibly important. The body needs time to accept the new marrow and for the new blood cell factory to start working properly. During this recovery period, the immune system is very weak, which means you are at a much higher risk of picking up infections. Simple germs that wouldn't normally affect you can cause serious illness. That is why protecting yourself is a top priority. Your healthcare team will give you lots of advice on how to create a safe environment to help you heal without any setbacks. Excellent hygiene becomes your superpower. Washing your hands frequently with soap and water is one of the best ways to stop germs from spreading. You should also be careful with what you eat. Your transplant team will likely recommend a special diet that avoids foods that could carry bacteria, such as uncooked meat, unpasteurized dairy products, or raw fruits and vegetables that are difficult to clean. Food needs to be cooked thoroughly to kill any potential germs. It might feel like a lot of rules, but they are all there to keep you safe while your new immune system gets stronger. Regular checkups with your transplant team are essential. These appointments allow your doctors to monitor your progress, check your blood cell counts, and make sure the new marrow is working as it should be. You will also need to take several medications. Some of these medicines, called immunosuppressants, help prevent your body from rejecting the new donor cells in an allogeneic transplant. Other medicines might be needed to prevent infections. It is crucial to take all your medication exactly as prescribed by your doctor, as this plays a huge part in a successful recovery. Finally, your daily life will need some adjustments for a while. Your transplant team will advise you on which activities are safe. You will likely need to avoid large crowds, public transport, and anyone who is unwell. Gentle exercise, like walking, is often encouraged. Your transplant team is there to support you every step of the way, helping you get back to feeling well and strong.